So.
Welcome to this live cast, and I'm so excited because the guest that's on the show today is one person it's a personal hero of mine that I've been following for years. So having him speak directly to you is a tremendous honor for me. And
click that when it's ready.
And what do you mean?
You click that and so that you have both on.
Oh, we do already. Yeah. So Albert Mensah is a natural skeptic scientist, and he's an expert in methylation, and he has his own clinic in Chicago, Mensah Medical. He is currently, and has been for a long time, training medical professionals in this forensic work that's needed when we're dealing with mental health and the expression of Pyrrol disorder, methylation, copper overload, and the biotypes that's overlooked almost everywhere in the established and the alternative medical society. So his field of expertise that is too long to be described in one sentence, but he works with autism, ADHD, anxiety, depression, schizophrenia, eating disorders, and this whole interesting field of diet and mental health. So today we're going to talk about why you cannot choose a diet without knowing your biotype, and why some of the most popular supplements, diets, including vegan, fish oil, fasting, and multivitamins can be problematic, really problematic for certain types. We're also going to talk about the risk of, dealing with these methylation issues by yourself, or taking one-day courses and go out and try and treat people. And then we're going to talk about autism and this whole false belief system that autism is for life and it is unreversible, and that anyone who claims that you can treat or reverse autism is crazy. And I'm one of them because I'm a mom who did. So welcome, Albert Mensah. Could you start by telling everyone about your journey from a very traditional skeptical scientist into this alternative field of expertise?
Thank you, Ninka. I'm very pleased to be able to speak to you and to your audience. And it's been a very interesting journey because I wasn't looking for any of this. Okay, I was practicing traditional medicine, very happy, very skeptical, very always research oriented. And it wasn't until a friend of mine, my current business partner, Dr. Judy Bowman, began a very frustrating search. She's the one who saw a 3-year-old child coming into her office on pharmaceutical medication at 3 times the adult dosage to treat behavior disorders. And we're talking about some very strong medication that no adult should be on this dosage, but a child was on 3 times the amount. And at that time, we had no real understanding about what kind of effect those medications would have. Anyway, she found the original Pfeiffer Treatment Center, and 1 month there, she had such amazing insight that she called me. And I was at the time already signed up to work somewhere else, but in any event, I told her when she told me that she saw autism cured, that she saw schizophrenia cured, that she saw bipolar cured. My first question was, wait a minute, are you sure about this? And then she said, yes. I said, well, this is great. How do they do it? And she said, well, they use, nutrients. I said, oh, come on. Now, taught in school, nutrients don't work. This is the first week of medical school. Everyone knows this. They do not work. Ladies and gentlemen, that's why all the doctors that you encounter say that, no, those things really don't work, because that's what we're taught. So I went there as she asked me to pay attention and to take a look at this facility. And I thought one of two things. Either this is the most amazing false concept of a place that I've ever seen, or it was the most amazing, groundbreaking effort that no one knows about. So while I'm a skeptic, I'm one who also has an open mind. And I decided, well, let me take a look at this place, and if it's false, I'll know it very quickly. I can always go back and do traditional medicine. So I went there, I took a look, I was in my car, they actually called me to offer me a job. I said, okay, and that was the journey. Ever since then, every single day, it's been a journey of seeing many of these psychiatric disorders revealed and healed in ways that we had no idea were possible. So for me now, it's simply a matter of fact that these things can be treated, as opposed to just giving drugs and getting no real improvement other than masking symptoms. Now, please understand, I am a traditional physician, so I'm not saying medications are bad for everyone. What I'm saying is that getting to the root cause is significantly important, and it can be done. So that's the short, long version, Ninka, of my journey.
Short and very sharp. I love it. So let's just try to dive a little bit into that and spread it out, because there's a correlation between this autism, expression of autism, and the diets, anxiety and depression, and also the Pyrrol, the methylation issues, the copper overload issues. So for me, I was a very skeptical, authority-driven journalist. Mom, I did everything that the doctors told me to do. And so that was antibiotics, stop giving breast milk at the age of 4 months old. That was the thing you did back then. And weaning him into real food. My child at that time started out breaking out in all kinds of symptoms: respiratory, coughing, asthma, eczema, and it ended up being on antibiotics all the time. And then at the age of 5, he was diagnosed by a psychiatrist with infantile autism. And I was told, there's nothing you can do, learn to cope with it. And I was in the Autistic Society, the Society for Moms that's supposed to support you. And they also told me, this is genetic and there's nothing you can do about it. No one ever told me anything about nutrition. And I know that that's what I hear all the time, is that it's genetic and he must have been wrongly diagnosed. In other words, you're a bit delusional, woman, because you believe that he was autistic. It's, everything he did was massively autistic, lining up things, these repetitive behaviors, couldn't touch him, no eye contact, screaming, no sleeping, all the typical traits. So what do you say to those who say it's genetic, it's for life, there's nothing you can do about it, and it belongs to the psychiatric medical field?
Every single one of those commentaries is absolutely incorrect. Number one, it is not genetic. Autism is epigenetic. Now, what does epigenetic mean? It means that you may have a genetic predisposition or a genetic foundation. However, the environment literally affects gene expression. So the environment, whether it's extreme levels of folic acid, which is one of the things that we talk about now as being one of the root causes of autism, extreme levels of folic acid superimposed upon somebody who is undermethylated. Now, we don't know what the baby's biochemistry is. Obviously, it's still developing. So we have to be cautious about any extra nutrients that we're giving, because epigenetic means how the environment affects the genes, and folic acid is part of the environment in the womb when the mother is taking it. So without that situation, it's quite possible autism may never have materialized. Mm-hmm. Now, the key here is that most autistic children are undermethylated. They have low levels of these methyl molecules that literally regulate DNA. That's why you don't try to do this on your own. Understanding genetics is hugely important, very core, in terms of understanding pathology and disease, and how things like autism may actually develop. So knowing that a child predominantly may be undermethylated, you want to keep extreme amounts of nutrients that would affect methylation away from the child. Now, that's just one factor. There are tons of factors that can produce autism. There are children who regress into autism. In other words, they're born quite normally, progress sometimes in a very advanced fashion. They're speaking languages by age 2, and then the final epigenetic trigger. It could be an insult such as a vaccination or a viral infection or something else causes the child to regress quite noticeably into this state we call autism. So autism is epigenetic. Number 2, autism is very treatable. Now, what the traditional medical world views as treatable is that you give a pill or a vaccine and then things clear up and you're done. Or you give a drug. Well, no, it's not that simple. Autism is extremely complicated. And when you're treating autism, you look at 5 different systems, to say the least. There's the gut, there's the brain, there's neurotransmission in the brain. But very key is inflammation, and then the big words I want you to remember forever is oxidative stress. Oxidative stress is like cellular rust. Rust creates holes, creates problems, creates an inability to function. Now, when you do that at the cellular level, it's going to explode and increase in terms of the problematic relationships and problematic expression, behavior in the full-blown adult. So the most important thing to remember, please, everyone, do not believe anyone who tells you that autism is not treatable. Ask all the children who go to school now, who are in college, who are in graduate school, who are becoming doctors, and they were diagnosed with autism at age 2. One of my favorite stories. A gentleman came to me who we treated in Chicago. His son was now being accepted to graduate school. He went to college on scholarship. And I said, well, Mr. So-and-so, congratulations. Your son went to school on scholarship. Beautiful. He said, Dr. Mensah, you don't remember. He said, this is the child that was kicked out of 4 different preschools because he was autistic. Now, after treatment, he's actually not only graduating from college and had a scholarship to college, he's now going on to get his graduate degree. This is just one of many examples.
And it's my son, that's my son's story as well, completely.
Absolutely. So please,
yeah.
autism is treatable, and
Yeah.
it's not genetic. There's environmental aspects to this, and we could just talk so much about this, but I'm going to be quiet so we can continue here.
Now, I only refer to one professional in the whole of Europe, and that person is being trained by you in Australia on a regular basis. Other than that, you refer to about maybe 4 or 5 doctors who are capable of this forensic work of testing, taking a good patient history, comparing the genetics with the microbiome, and testing for all the other underlying issues. So how many doctors on a worldwide scale will be able to reverse autism? What does it take?
Well, that's a very interesting question. Now, I can't vouch for that particular number. I really would not know. What I can tell you is that we have doctors globally trained in our process and procedure. But please understand, there's a learning curve. Mm-hmm. It takes at least 5 solid years of every single day training, like a residency program, and being supervised by the experts. That process doesn't happen anymore. My business partner, Dr. Bowman, and I were probably the last ones to be trained that way. So what we do is we begin a process of training doctors, and they go and they advance, and year by year they come back for more and more training. In Australia, we have probably a good 200 to 400 doctors who are trained in our methodology. Now, that's mostly for psychiatric disorders. Yes. Autism is a bit of a different creature.
Yes.
They're very big, and what I can tell you is that there are a tremendous number of doctors who get improvement in the condition of autism. Tremendous improvements. How many actually reverse? We don't have statistics on that. But in the United States, we're a lot more, shall we say, fine-tuned in the sense that there aren't that many doctors who I can say routinely reverse autism. But I can certainly name them. I'm going to refrain.
Yeah.
But there are 3 outside of our clinic. There are at least 3 doctors in the entire continental United States that I can say routinely reverse autism.
So I want to, so that this is not going to be a live all about autism because that's my story and that's an extreme story. But I also have all the other underlying issues in my family and genetically, both of my sons and me, that causes anxiety and depression and aggression and mood swings. So that a 7-year-old can understand under methylation, what is it and how does it correlate? In other words, a vegan diet or a juice cleanse or following all these extreme, very popular diets that seem healthy, how can they increase the risk for having a child with autism or as a woman struggling extra hard with depression or anxiety or even suicidal tendencies? What is it about these healthy diets that we need to be very careful around as women and as practitioners?
First of all, that's a very powerful question to be asked. One of the questions, whenever someone says to me or asks me what the best diet is, I always tell them it depends on who you are biochemically. We've had a family of 5, 2 parents and 3 children, come to us for biochemical testing. And each one of them was different. There was overlap between some segments of the father and 2 of the children, some segments of the mother and 2 of the children. One child sat independently. And my first comment to them after we had their test results was, I'm very sorry, but the 5 of you sitting at the same dinner table is going to be next to impossible. Each one of you has a different challenge. One of the children was copper toxic, so that means that foods that are high in copper, like almonds, like pistachios, like dark green leafy vegetables, many of these things are a problem for that child. Now, the other 2 children were absolutely fine and did not have a copper toxicity. Okay. Yet 2 of the children were undermethylated, 2 of the children were over-methylated. Now, what is methyl? Methyl is a biochemical molecule. It's a carbon atom with 3 or 4 hydrogen atoms attached. What does methyl do? Methyl acts like a switch. It is an on and off button. It attaches itself to enzymes. It attaches itself to hormones. It attaches itself to your brain chemistry. It even attaches itself, please understand this, it attaches yourself to the very DNA in your bodies. Now, when it does that, it turns things on and it turns things off. And it has to be done with proper regularity. So methyl regulates your system. It tells it when to go and when to stop. Now, if you don't have enough, you're called undermethylated. So many systems that should be turned off, unfortunately, stay turned on. And that's one of the cases with regard to behavior and with regard to anxiety and depression in anyone, not just children with autism. Now, in other cases, for example, someone who is over-methylated, many of these individuals, their brains can't shut down. They're constantly thinking, they ruminate, they can't sleep at night. But because of this constant brain activation, they tend to be very creative people. Many of the actors, many of the musicians, many of the composers, many of the great people in the arts are actually overly methylated people. Their brains don't turn off very easily, and they're hyper-stimulated. Okay? So methyl is a regulating switch. It's a button that says on and off. Most people in the world are actually normal in their methylation concentration, their methyl concentration. But about 35% of the entire planet is too low, in which we call them undermethylated. And then there's a certain percentage that is too high. To the extremes of either side, there are problems. So now if you talk about diet, anything that's going to take methyl from your body is going to make you sicker, less capable, less functional. So if you're undermethylated, functional demethylating agents are often seen in dark green leafy vegetables. So people who want to go vegetarian or vegan, for them, if they're undermethylated, that's not going to be a good idea.
What's going to happen then?
Well, if they suffer from depression, if they suffer from anxiety, if they suffer from anorexia, body dysmorphic disorders, if they suffer from schizophrenia or bipolar disorder, if they even just have ADHD or OCD, obsessive compulsive disorders, alcoholism, any kind of gambling addiction or any kind of addiction, any of these tendencies can actually be worsened by a high vegetable diet in an undermethylated person. And that's because these high vegetable diets steal continually more and more methyl. It's like if you have 5 switches that operate your entire house and somebody takes 3 of them away, it means that most of your home is going to be operating in darkness most of the time. And that's what methylation is like. That's what being under-methylated is like. You don't
And
have... Yes.
Yeah, just to pause you, so I'm sure that everyone understands, because to many it's really illogical. When I'm undermethylated, and currently there's educations, 1-day courses in Denmark where the lingo around it is, if you're undermethylated, you're probably lacking B12, folates, and B6. And to so many people, it's like, okay, if I'm undermethylated, I need to add methyl donors. I need to take more B vitamins and leafy greens. And what you're saying is that it actually steals methyl to take those folates, whether it's juice, methylfolate, folic acid, or whatever it is. Can you try and explain it so that a 7-year-old understands?
Absolutely. Very simple terms. There's misconception around this concept as to what undermethylation means from a genetic perspective and what nutrients you use to treat it. Now, I want you to understand, I want you to imagine a secret agent, a double agent in the movies. In the one world, he's your friend. In another world, he's your enemy. Same person. When you look inside the cell, and there's the center of the cell where control is, the control room. When folic acid enters the cell in general, yes, it's a very good donor of methyl. But then it goes to the control room, and then it steals 10 times as much methyl as it ever donated. So it is a sum total stealer, remover of methyl. It is a donor in one area, but more importantly, a thief in the larger, more important areas of the cell. So when you take things like folate, folic acid, folinic acid, it makes no difference if it has FOL in it. It will ultimately remove methyl from your system. Okay? So what people consider methyl donors, you have to understand where the donation is being placed and where the removal is also happening. That's very, very key. And you can't just take a given nutrient or a given supplement without knowing the correct dosage, without knowing the other elements that influence that situation that can say you're giving too much or too little. Basically, those types of programs and suggestions are guesswork. They're shot in the dark. That kind of a program is no more qualifying than I'm able to fly the most complicated jetliner or perhaps take the space shuttle into outer space because somebody gave me a 1-day lesson on how to be an astronaut. It requires years and years and years of medical training. These are medical conditions. These are not conditions of social challenge or something simple. Most of the physicians on this planet right now don't understand methylation. They're just trying to get an idea. So a 1-day course is certainly very dangerous. Very dangerous.
So some of the misconceptions is that, so this is just a description of it, is a course for health practitioners and dietitians who wants to give supplements and dietary advice to treat cancer, diabetes, thyroid issues, autism, fatigue, psychiatric conditions, infertility. And the description of undermethylation and overmethylation is that the underactive process is caused by the lack of B vitamins and accumulates homocysteine normally, and that's basically it. And the overmethylation is about a condition where you turn off the gene expression so that you can't complete DNA repair, and that will increase the risk of cancer. So that's a simple explanation that's used. What will happen if someone is taught from this whole paradigm and go out and try and help people with these conditions without a medical background?
In the best case scenario, there'll be no change. The difficulty is that what you're describing is worthy of malpractice in the United States and many parts of the world. People will get sick, people will get cancer, people may die, people may commit suicide, people may commit harm to other individuals if they don't just necessarily harm themselves. That kind of a paradigm is asking for serious, serious trouble. You have to have a far more difficult level of education to truly understand and be able to wield what is genetic manipulation. Epigenetic manipulation is even more difficult, and that's what these processes really require and what they are. No one is qualified to do that from a one-day seminar. That is literally absurd. And I'm just saying that because I'm a physician who cares about people. We've dedicated our lives to helping people and to spread the word about the problems that exist that can be changed, but they have to be done correctly. I mean, listen, no one would need me or anyone else around if you could take a one-day course and fix it all. You've got tremendous
No, exactly.
volumes written on this subject, and physicians are having trouble disagreeing or agreeing on this sort of thing. Researchers are having difficulty, and they've been spending their lives trying to address these issues. No, that kind of a paradigm is extremely dangerous, and it will cause trouble. It will. You'll see the rates of certain types of disorders increasing, including cancer, by the way, because each cancer is different. There is no generality about treating cancer. Some cancers respond very well to methyl. Other cancers become worse with methyl. Folic acid is not something you would give to many cancers, but some you do. You have no idea unless you understand cancer. I have counseled actual oncologists on how they were treating their patients, and they actually changed the process after speaking to us. So please, extreme caution. You're wielding tremendous power, and you're not equipped to do it if you are not one of these licensed to practice medicine individuals.
Exactly. And that's why you currently are working extremely hard to create these education programs. It's very complicated, and algorithms so that you can deal with people on a larger scale. But until that's completed, it's testing, protocol, testing, adjusting, and testing and adjusting with a practitioner as qualified as you, just to make that completely clear.
Absolutely.
Now let's talk about how these diets, so under-methylation, over-methylation.
Yes.
The thing that's currently very popular is vegan. So we've got influencers with 2 million followers, and we've got 8 million Americans going on a vegan diet right now. It's all the rage. We have got a lot of MLM companies handing out fish oil to everybody,
Yes.
doing blood tests and giving out omegas according to some kind of blood test. And then we have these ketogenic high protein diets. And why is it that we also have bone broth that's given out to everybody, high glutamate, high histamine foods? Why is it that all these popular things that look healthy from the outside can be detrimental, and to what biotypes?
Yes. Okay. So first of all, I'm not going to say that any diet is bad, except maybe a high sugar, high carbohydrate, high everything like that kind of a diet. You know, it has its place. Each diet has its place. The first thing we have to ask is, number one, who are you biochemically? Number two, what is your goal? There's a difference between weight loss, weight maintenance, and eating for your physical health versus eating for your mental health.
Yeah.
If you're eating for your mental health, then it is absolutely important you understand elements involving methylation in terms, are you an undermethylated person, an overmethylated person, or a normal methylated person? What is good for the body is not always good for the brain. And this is what we have to be very specific about with our patients and anyone we're talking to. So if you're somebody who's got, say, depression, and you are undermethylated but didn't know it, and you decide, well, you hear that a high vegetable diet is good, so you eat some, but depression is not getting better, so you go more intensely, you become a vegetarian, and you find that your depression is getting worse, so you become a vegan, and you find that your depression is becoming worse, and you're almost suicidal, and you don't know why. Okay, It's because you've been getting more and more and more intense in the wrong direction. You actually need more protein products from animal sources. Now, if you're an overmethylator, you should be doing very well with that kind of a diet, quite actually. Okay. So it's not that we have a preference for one diet versus another. The question is, who are you and what are you doing? If you are a high copper person, for example, some of those same dark green leafy vegetables will increase copper. And if you have depression, it can actually take you into psychosis. It can take you into severe debilitating depression. It can take you to poor focus, constant anxiety, rage, mood swings. All sorts of terrible things can come strictly from your food. I want everyone to understand this. Food is a drug.
Yeah.
It is a natural drug. So whatever it is you're eating, it's going to get broken down into its chemical components and affect you at a molecular level. So we have to be very cautious about this. Now, let's say you're not just quite so simple. Let's say you're an undermethylated person with high copper and you have what's called Pyrrol disorder. Now, Pyrrol disorder is a disorder where you have lots of mood swings, anxiety, depression, rage, very, very short fuse. You can do this sometimes several times a day. The smallest thing makes you explode in rage. Now, that's because of a molecule that steals certain elements from your body as well. But when it does that, those elements are very key in making you neurotransmitters. So if your brain chemistry doesn't have what it needs in order to be regular and normal, then these cycles of mood changes occurs very quickly. Now, from a dietary perspective, if you have Pyrrol disorder, you don't do very well on omega-3 fish oils. Omega-3 fish oils are wonderful for everyone else. Beautiful. We all recommend it for patients who have various conditions, heart conditions and so forth, and who are normal. However, if you have Pyrrol disorder, there's a strange switch in the system. Omega-3 fish oils make you more inflamed. They worsen the condition. And you actually need a different oil, an omega-6 usually. Okay. I'm not going to say too much because I don't want you people out there going to do this yourself. But I want you to understand that omega-3 fish oils are not good for everybody. It depends on who you are. So most people, by the way, have various combinations of chemical imbalances. So it becomes extremely fine-tuned, their dietary regimen, if there is a cognitive disorder that's also in place. So if you have anxiety, depression, schizophrenia, bipolar disorder, rage issues, any of those things, and you're looking for the proper diet, you actually have to look at your entire chemical spectrum in order to identify the foods that can be good in one area but challenging in another. So working there with a good practitioner who understands how diet correlates with chemistry is absolutely necessary for your optimal improvement. Fad diets are not for everyone. If you are one of those people, life is wonderful. No problems in any direction, no emotional changes, no nothing, no diagnoses, then pretty much you can do whatever you want to do. Okay. However, if you suffer from any of those conditions, you have to rethink fad diets. The ketogenic diet, there's nothing wrong with it. Well, unless you have a heart condition, some people are concerned about the excess levels of fats that build up. But if you're trying to lose weight, it's a great program. And if you are undermethylated, it's likely a better dietary regimen for you than being vegetarian or vegan. But if you're overmethylated, oh, no. The ketogenic diet can actually cause you to lose sleep. It can cause you to be very uncomfortable when you're trying to just go through life daily. You can become depressed and not understand why this diet, for which you're trying to lose weight, isn't helping you achieve that because you're so depressed, then you want to overeat when it's time to eat. And you're eating all the wrong things. So one size fits all does not work. One diet is not good for everybody. Yep. And now our medical practitioners, medical science is teaching us just that. Ninka, a very recent study showed after 50 years of monitoring diet and dietary regimens for the purpose of longevity, for living a long, optimal life, they now say that eating a broad-based, general, balanced diet is the best way to have a long life.
Hallelujah. All that for all, much ado about nothing for all these years, right? Back to the good old-fashioned reasonable, intelligent, logical way of eating, the way nature intended it to.
And you know, if I may just make one comment on that, why does that make so much sense? Because most of us don't know our biochemical makeup. So
Exactly.
if we eat a balanced diet, we're not going to eat too many things that can affect undermethylation. We're not going to eat too many things that affect overmethylation.
Exactly.
We're not going to eat too much that can push copper in the wrong direction. Everything is a little bit, and so we maintain normalcy. That's the balanced diet. That's the benefit.
Love that. And we might add that even though people with Pyrrol disorder don't do well on fish oil, it doesn't mean that they cannot eat fish. Am I correct?
Correct. Correct. What we're talking about is, when we're talking about Pyrrol disorder, we're not talking about the diet. What we're talking about are supplementations, additional pieces on top of diet. Fish oil is necessary. We all need it. We all need some level of omega-3s. But when you have Pyrrol disorder, you don't need to go out and grab extra supplements and take them every day. If you eat fish once, twice a week, that's fine. Cod, for example, or salmon, or whatever your favorite fish is, that's okay. You don't need to eliminate it from your diet. But don't go reaching for extra supplementation, which is concentrated, much higher dosages of the omega-3s. That's the problem. Dietary omegas is okay.
I'm getting a lot of comments here. Hallelujah. And I could listen to this man the rest of my life. And this is so interesting. It makes so much sense. Excellent, excellent, excellent. I also have some questions. I'm going to get back to those. But can you just touch on multivitamins and B-complex? Because it's a standard treatment. Almost every dietitian, alternative health coach, practitioner will hand out a multivitamin and a B-complex. And why is that so complex? So for me, all of these issues is in my genes and in my family. So I've been up and down until I found you and your gang and finally understood why all the things I didn't understand about my anxiety, my child's anxiety, ADHD in one child, or autism in another child, these mood swings and bitchy behavior, the biochemistry around that, the testing and the protocols. So long story short, I've been taking hair supplements and gotten into an insane aggressive state of my life until I realized there was copper in it. And I've been taking a bone supplement because I thought I needed more zinc and magnesium, and had huge anxiety and trying to figure that out from a psychological point of view. What's wrong? I need trauma healing, until I turned the bottle and realized it's full of copper, and I have Pyrrol disorder, and so that's my issue as well. Can you name the most common biotypes and the problem with multivitamins?
Okay. Well, let me go in the other direction. The problem with multivitamins is that they're not treatment. They're simply supplements for the diet. In other words, they're so minuscule, so tiny in dosage that they're not going to do anything. Okay? You can take 1 milligram of vitamin B6 and it's not going to treat a methylation disorder. It's not going to even be part of it. It is simply something for the body to help subsist. People, let me share with you. When you're dealing with cognitive disorders, mind disorders, brain disorders, it requires several times the concentration of the recommended daily allowance. Several times. We're talking about a nutraceutical, an almost pharmaceutical drug-like concentration in a natural element. That is nature's treatment. It requires high concentration. Multivitamins are in such minuscule amounts, the average multivitamin would not even affect a child of age 3. That's how low the dosage is. So you can take it. It's likely not going to harm you, but it's not going to help you. Okay. Now, if you've got something like copper toxicity, then even the small milligram dosages of copper in a multivitamin can be a bit of a problem. Now, B-complex, this one bothers me. It's bothered me a very, very long time because we treat B vitamins as though they're the same thing. They are not. They're not in a family outside of the fact that they're called B. Vitamin B1 is different from vitamin B2, is different from vitamin B3, different from B9 and B6. They should be treated as individual elements, and that's what we do in our field. You cannot just say take a B complex. Why? Niacinamide is classified as a B vitamin, yet it is contraindicated in someone who is undermethylated. However, somebody who is undermethylated.
Yeah, why is that?
Yes. Well, because what niacinamide does is that it actually lowers dopamine levels. And if you're an undermethylated person, you typically have low levels of serotonin, dopamine, norepinephrine, and calming neurotransmitters like GABA, gamma aminobutyric acid. So if you're already low in dopamine, why would you take something that's going to lower it even more? It makes you worse. Yet it's in a multivitamin, and it's in a B complex. So what a person may need is they may need vitamin B1, they may need vitamin B6, but they don't need vitamin B3. Or B5, pantothenic acid, is also in a B complex and also not useful for undermethylators in general. And of course, in the B complex, we have folic acid. We've already talked about folic acid. So now if you're an undermethylator taking a B complex, you're exposing yourself to 3 elements on minimum. Folic acid, niacinamide, and pantothenic acid that are virtually contraindicated in undermethylators. Now, if you're an overmethylator, wonderful. A B complex, not a problem for you, okay? Because everyone can use the other Bs, but those 3 that cause problems for undermethylators are actually beautiful for treatment for you as an overmethylator. But now let's be functional. A B complex is also typically not in any high enough concentration to provide any true benefit, but it could do harm in the wrong category of methylation disorder.
Before you move on to Pyrrol disorder and the copper connection, why does undermethylation and the wrong diet and supplements increase the risk for postnatal depression and for having a child with autism spectrum problems or learning difficulties later in life?
Okay, you asked 2 very, very complicated questions that we lecture on for hours. First of all, we understand that children with autism as a category is typically about 85 to 95% undermethylated. Almost all the children with autism are undermethylated. A few are actually overmethylated. Now, remember, methyl is a controller. It is a switch that turns things on and off. If you don't have enough of those switches present, okay, you're not going to have proper cognitive functioning and very difficult body function in other areas. So if you are looking to take a multivitamin or giving a child a multivitamin who is undermethylated and it's high in folic acid, it just makes them worse behaviorally. Okay. I want to go to the whole concept of postnatal depression.
Yeah.
Now, it's actually my partner, Dr. Judith Bowman, who worked with Dr. William Walsh, who did the groundbreaking work on discerning the major cause of postpartum depression in the vast majority of females. Somewhere between 65 and 75% of all females with postpartum depression or postnatal psychosis are copper toxic females.
Yeah.
Copper toxic females, it's not just that you're in the environment full of copper. Your body, here's genetics. Your body is not genetically programmed to be able to get rid of copper the way everyone else's body does. So again, regulation, copper is not regulated out of the body of 35% to 45% of all females on this earth. Wow. They're the ones who have horrific menstrual cycles. They're the ones who have anxiety and depression, severe mood swings, rages, the week before or the week after their cycles. They're the individuals who suffer some level of postpartum depression after the child is born, or they move into depression and psychosis after the child is born. These are issues of copper toxicity. In addition, these females may have chronic fatigue. They may have fibromyalgia. They may have uterine fibroids. They may have chronic fatigue syndrome. I think I said that already. But they may have ovarian tumors. And even more serious, they may be at higher risk for the development of uterine and breast cancer. Part of the question we ask any female that we suspect is copper toxic, who has a family history of any of the things we've talked about, or postnatal depression? Is there a family history, aunt's grandmother, of breast cancer? That is usually a signal that there is a copper dysmetabolism present. Now, I know some of you want to know this, so I'm just going to tell you. Why is that link between copper and cancer? Copper helps to build blood vessels. And copper is sensitive to estrogen, which is why you typically see more copper challenges in females than you do males. Now, a female is designed to grow baby. Now, I don't want to hear anything about sexism or anything like that, but let's just talk physiology. Females are designed to grow babies. In order to grow a baby, you need blood vessels. Without blood, the baby's tissues can't get nutrients. Copper helps to build blood vessels. That's why if you're a copper toxic female, you're more likely to have vasculature going everywhere that leads to fibroid tumors, cancer of various types, as well as the cognitive challenges, which is why you may actually have more painful menstrual cycles than some of the other females that you know. Prostaglandins become highly potent and highly challenged when copper is added to the issue. So you see, it's not just one thing. Copper is a very, very powerful element that moves through multiple systems. Okay, but in particular, it's copper that's predominantly a challenge in postnatal depression. Now, it's not that there's a direct biochemical relationship between copper and the pyrrols. Not direct. Two things. Copper tends to help keep zinc in place. And so when copper is high, zinc tends to be lower. And you can't make your neurotransmitters without zinc.
No.
But the other side is that pyrrols are disorders of stress intolerance. Whether you're emotionally or physically stressed, both of which happen around the time of each menstrual cycle, pyrrols go up. If you're pregnant, that's an extra stressor. That baby is a living organism that just sucks the life force out of you, and you become fatigued, but your pyrrols go up. Now, as a result of that, now you may develop mood swings, sensitivities, rages, all those things, because your pyrrols are elevated, because your copper levels are high, because of the in-between things that happen. Not a direct correlation, but the indirect correlation. Okay? So if you correct pyrrols, for example, you're not going to fix the copper automatically. You have to address each individually, each separately. And that's kind of the connection between copper, pregnancy, postnatal depression, and pyrrols in a very, very short kind of a setting here, short discussion.
So to kind of sum that up, when you're dealing with depression, ADHD, anxiety, and OCD and eating disorders, personality disorders, and behavioral, these stress intolerances, mood swings, aggression, all the elements that needs to be understood is the genetics, it's Pyrrol disorder, it's under and over methylation, and it's a copper overload spectrum. So the Scandinavians and the Irish descent are genetically disposed to Pyrrol disorder as well.
That is correct. And I'm glad you brought that up, because many people think pyroluria or Pyrrol disorder is just a genetic construct. It is not. It is environmental, and it is also genetic. Anyone can get Pyrrol disorder. It can be acquired. Most of our children and most of our teenagers go through Pyrrol disorder one time or another. Why? Because both time periods are periods of tremendous physical, emotional, and physiologic stress. Growing is a tremendous stressor. And we wonder why our little beautiful blonde-haired, blue-eyed 2-year-olds are running around screaming one moment, jumping in your lap, laughing the next moment, crying the next moment, all within an hour. Well, it's because they're tremendously stressed. Our teenagers, they're going through emotional change, psychological change, physical change, as they transition from young person to an adult. That is stealing so many elements, so many nutrients from the body like zinc. Okay? And so pyrrols are tremendously powerful, but anyone can get them. Just because you're not Scandinavian, just because you're not Irish, doesn't mean that you're safe. Okay? I've seen African families of 5 with some of the most powerful pyrrols around families from Venezuela, families from Chile, families that are of Asian orientation, Asian descent. There is no one that is safe from Pyrrol disorder. No one. However, knowing that you have a background that is either Scandinavian or Irish pretty much says that you can guess that 85% of the time mood swings are present, or erratic behavior, or a tendency towards alcoholism, or any of these rageful emotional states that unfortunately the Irish are stereotypically viewed by television as having. Any of those times, yes, there's a very strong genetic likelihood that Pyrrol disorder is at the root of it.
Wow, and isn't that just interesting? I'm wondering, so you're cutting out a little bit. I'm wondering if that fan in the ceiling, would that be affecting your Wi-Fi? Now it's sharp.
It is possible. Give me 1 second. I'm going to try to correct that there.
Wonderful. So how do you, so there's two questions here coming in. How do you address, so in your practice, how do you treat these conditions and how do you test for them?
Okay. First of all, let me share with you that the reason why I am attracted to this field, why I actually believed it and stayed with it, besides the results, is that it follows the same basic principles of traditional medicine. Number one, you listen to the patient. We spend on average an hour to an hour and a half personally talking to the patient. Our nurses spend between 45 minutes and an hour and a half talking to the patients before we do. So we gather a great deal of information, not just your personal history, but your family background, your family history, everything that gives us some orientation into what your symptoms are and your condition. And then we test. So first there's history, then there's a physical exam, then there's testing. Based upon those test results, we determine what the conditions are, and then we develop a treatment program around it. That is the typical medical paradigm in medicine. And that's the same paradigm that we follow. So after the history and so forth, we've got to find out what your test results are. We fine-tune testing based upon the symptoms and the diagnosis that you give us. And then we develop a treatment program to address those things. So we put together nutrients, not by guessing, not by clumping them as groups. Individual nutrients as individual as any one of us on this planet. We take this element and this element. Every single element we use has a purpose. Some of them multitask, and we know exactly what those things are. So in other words, there's no guesswork. There's no axiom of generality. We're talking about very specific elements at very specific dosages. We have to know what the proper dosages are for children, for teenagers, for adults, and the dosages just are not about height and weight. The dosages are also adjusted for the intensity of the biochemical imbalance that's had. There's a great deal of fine detail that goes into every single patient. We make it look easy because you get what looks like a very high-tech concentrated multivitamin. But for every single element there, we know it like we know a family member or a friend. Yeah. Very, very closely, very intensely, monitoring every aspect. So it is a programmed, consistent process, and it requires truly powerful expertise to be able to do this well.
Exactly. And that is why anyone...
I think I've got this. Ninka.
Yeah, so anyone who wants to learn about this and wants to help people go further into this field need to latch onto this massive knowledge that's been built up over how many years? Because you were mentioning Walsh and Pfeiffer Institute, so their research that you're building on, how many years does this go back?
Probably about 4 decades.
Yeah.
Great Carl Pfeiffer is the man, the legend that we owe a tremendous amount to. This is a man who was a psychiatrist, a traditional psychiatrist, but also a researcher PhD, who refused to accept that people in his psychiatric ward were relegated, were stuck with taking drugs. And he began investigating, researching, testing, and he developed a nutrient protocol that seemed to wake up people who were in comatose states. People who had anxiety improved, and so forth and so forth. And he had been working on this process and building with it over time. And he started, Dr. Walsh met him, and they started working together to do the research more powerfully. And we started working with Dr. Walsh. And so we began training globally and speaking along with Dr. Walsh. And now we take this program even further in many ways in different directions. Now we're adding to it the biochemical relationship between physiologic challenges and now biochemistry as well. So not just brain disorders, but more completely how the entire body relates and responding. Interestingly enough, Ninka, the very nutrients we use, now people who are the doctors, the professionals in ophthalmology for eye disorders like macular degeneration, like glaucoma, they're using the same nutrients we are at similar dosages.
Wow.
They're beginning to recognize the power. People who've had heart disease, they've talked about how their hearts have done far better on our nutrient programs than without. One lady told us she was supposed to have been dead 10 years ago. And she said she believed that our nutrient programs were helping her survive. And I thought, oh, that's lovely. Thank you very much for that. You know, I'm sure it's coincidental. I didn't tell her that, but that's what I thought. Now we find out in the studies that the very elements we're using help cardiac health. So the more we learn, the more we realize, the more we don't know.
Exactly.
And that's scary. But now we're also understanding the tremendous body benefits outside of general nutrition, the actual power that sits in a given nutrient. So you also need to know things, however, like if you've got a heart condition, if you have high blood pressure, if you have diabetes, there are certain nutrients you must not take. Manganese, for example, is contraindicated in somebody who's got hypertension or migraine headaches, just to name a few. So if you've had a concussion, you don't need to take manganese. I'm just sharing that with you.
Wow.
So now, where's manganese found? In a multivitamin, right? So it's found in enriched and fortified foods. So now you who know your medical condition, but the people who put together these nutrients don't know that these things also can cause problems, creating difficulties in you.
Mm-hmm.
So this is what I'm saying. Being a scientist is very powerful and a requirement in this realm. Because we've had nurses, not our own, who read on their own, put their husbands on nutrient programs, not knowing that they were actually making their husbands worse.
Yeah.
One nurse was giving folic acid to her husband because he had a heart condition and didn't realize why he was becoming more and more depressed and suicidal.
Wow.
So there's a strong correlation that you have to be careful. You really do.
And that brings me to the questions, because so there's questions here about how do I test my biotype in Denmark, and don't so what about multivitamins and fish oil for our children? So just to start with the Denmark aspect, at the current moment there are nobody located in Denmark from this network who can do you might be able to get the testing done, but then the genetic profile won't be complete, and the one that take one of the two of these tests won't know how to take the history and follow up with the nutrient protocol. And so I see very bad or insignificant results when people come to me and ask for help with where do I go, where do I get tested, how can I get help. So currently it's not possible in Denmark, it's possible in the UK, and it's worth...
I'm sorry, our internet connection.
So am I dropping out? Yeah, so it's possible in the UK and the US.
Yes, go ahead.
So they ask, do you work from long distance, or do we need to visit you in person in the United States? It's complicated to travel with our son with autism.
Yes, now that I do understand. I believe there's a doctor in Switzerland. We can find out that information as well. But also there's at least one or two doctors in England. And yeah. Germany is having some very, very interesting programs now. As I understand that even Pyrrol disorder might be covered by insurance and the treatment of that in Germany. Now, my molecular medicine and quantum science I can do, but Geography I'm not very good at, so I have to say, if Australia is closer, and I don't know if it is or isn't, we've got well over 300 to 400 doctors there who can
Yeah.
certainly help you. There can be phone conversations had in order to kind of review test results. So it is possible to do things from a long distance perspective. Of course, the best result and the most optimum way to do this is to have an in-person visitation and to have a doctor working with you who is truly experienced in this process.
Yes.
Okay, that is the best way. And here's one of the difficulties. When you are doing what is on the cutting edge, usually there is not the infrastructure to help support that for a good period of time. The man who invented the first telephone, who did he call? What phone service did he have to fix the phone outside of him? Okay.
Yeah.
He couldn't call Sprint, and he couldn't call a Nextel. They didn't exist yet. So in the same way, because we are, in a sense, we're really all pioneers in this field. We're still waiting to have the entire global network available of laboratories, of capacities to see people and to treat them within a 5-10 minute distance. So we say patience, number one.
Yeah.
It will get there. If you have an autistic child, it would truly behoove you, if you can, to drive or fly wherever you can to see one of our experienced practitioners. Okay? Because this condition does not have to exist in any child. The sooner you do this, the more results you can see. And the sooner you will be happier, more content, get more sleep, less stressed, and be able to see that child's future, the future of that child that you dreamed of for 9 months in utero, and when the child was born, become realized. It is not only possible, it happens very often. I'm not saying everyone that happens to, but the vast majority of children can be helped.
Yeah.
But they're not because people just don't know.
What would you say to the organizations who work against this and say, so in Denmark, for example, the Autism Society say it's dangerous to change the diet and it's quakery and it's nonsense, it's not backed by science. And this is a very powerful organization with so much financial backup as well. What would you say to that?
Well, first of all, let's start backwards. It's backed up by tremendous science. In fact, some of the science is very interesting. Some of the very science we use comes from the journals of psychiatry in America. Psychiatry does a lot of research at the molecular level. We take that research in addition to orthomolecular research, and we put those paradigms together. These things are evidenced, and anyone can access them. You just go to those journals. So the research is there. People say the research isn't there because they don't know. They haven't looked. They haven't checked. Or they don't know the right sources to look. Okay? The research is everywhere. Now, the other side to this is that usually when people say something can't be done, it's because they haven't seen it done themselves. Mm-hmm. It doesn't mean it can't be done. If we always believed everything that couldn't be done, one of my favorite stories was Dr. Blaylock. There are two arteries that come from the heart. One of them is the aorta, one is the pulmonary artery. One gives oxygen in blood, one removes it. And in certain children, the two vessels are actually shifted. It's called transposition of the great vessels. There was a man who did a lot of work in trying to correct that problem because what we had was called blue baby syndrome. Mm-hmm. With blue baby syndrome, babies lived for only a few days, maybe a couple of weeks, and they died. They died. And this man said there has to be a way to do something better. So he did a lot of research and he began experimenting. Do you know what his colleagues said? His colleagues said, listen, these children were born this way. Let them live their wonderful lives for the short period they have with their families and then just let them die peacefully. His colleagues were saying this to him. Let's fast forward a few decades. The Blaylock procedure is commonly accepted and used in traditional medicine, and it is expected that when a child is born with these vessels that are changed, that it can be corrected, and that it does it is a natural, normal thing and it can't be corrected, it usually means we don't know how to correct it.
Yeah.
Odds are someone will.
Yeah.
And we already know.
Yeah.
Just ask all the autistic children who lead normal lives now,
Yeah,
who
exactly.
are no longer called autistic.
Thank you for that one. And that's another question here. Does this possibility, this is Anna's question, of reversing and bettering these children's condition, is that for all children on the spectrum? So even the ones that are kind of unspecified, not infantile or Asperger's, but just these kind of trash can diagnosis where they say unspecific autism or whatever that term is in English, I'm not sure.
Yes, absolutely. Absolutely. You know, first of all, sometimes people misdiagnose what is autism versus pervasive developmental disorder, not otherwise specified, versus somebody who's got what I would call a spectrum-like disorder. Something's not quite right with the child, but they're not quite autistic yet. They're not quite normal. Well, here's the beauty of the situation. Again, you do your history. You listen to the family. You find out what's wrong. We've seen now, we understand the correlations to very specific parts of the brain that are challenged and how different chemistries produce different challenges in the person in terms of behavior, in terms of development, in terms of learning. So it isn't always about simply a diagnosis. It's about understanding how these conditions work. And then the relationships between everything from not just neurotransmitters, but molecular medicine and methylation to the gut. Some children are far more gut toxic than others. So it's not a one size fits all. We have our gut people, we have our brain people in the medical community. It's about who is this child specifically. When you identify where the major problems lie, that's when real healing begins. Until you do that, you're going to be floundering around doing thousands of tests and spending thousands of dollars and getting nowhere. Okay?
Yeah.
There's a consistent process to identify where challenges begin, or at least where they're creating the most havoc, and you can rectify that. Okay.
Yes.
So that's kind of how you need to approach these conditions, and it's not about the diagnosis. Who is the child? If I call a car a flower, the car still has four wheels and it still goes. It makes no difference what the term is. It's the condition of the patient.
Exactly. And also, so I went to America and I worked with some of the best doctors. One of them is dead now, but I had to go travel and learn. And also we need to understand that nutrition and a clean lifestyle is really, really the basic necessity for these children and these families. So in the institutions where my son was in the beginning, they were fed Coca-Cola and candy and chips. It was kind of like a coping mechanism, trying to make life good for them by giving them comfort foods. So what's your take on that?
That's horrible. We understand one of the major challenges that oftentimes is seen in children who are in the spectrum is yeast toxicity. And when we call something a comfort food, we're actually not comforting ourselves. Many of you may not believe this, but if you crave carbs, the odds are you have yeast in your intestine, yeast in your gut. They actually are the ones telling your brain to eat more of these types of foods because those foodstuffs, when they break down, feed yeast. When you clear the gut of yeast, you generally do not have those cravings. As a matter of fact, you tend to have cravings for extremely healthy foods, and you wonder why on earth you ever drank the Coca-Cola in the first place. It tastes almost like poison once you've cleaned your system. So imagine what this does now in a child. In a child, yeast create malabsorption. They create hypoglycemia. They actually send toxins through the system that leave the brain inflamed and produce tremendous oxidative stress. They do things at the quantum level of medicine, which we're not going to get into yet. We still have a good number of years before we break that down. But even the flow of electrons can be challenged by yeast. And when I'm speaking about that, I'm really bringing more into light Eastern medicine, as well as medicine practiced by the Indians in East India, at the level of organs and organ systems and the flow of energy. that flow of energy is really being reflected on the micromolecular level, at the atomic level, by what we in science call electrons.
Yes.
So there is correlation. It's not mysticism. It's understanding the science. And that's the next step. But you'd be amazed to understand how one element, be it something positive like zinc, one of my favorite elements, zinc, versus something negative like Pepsi Cola, in terms of you drinking lots of it, how just that one element can have tremendously positive effects globally in your body and brain, and how the other one can have tremendously negative effects. When you drink Coca-Cola, of course, there's glycosylation. There's dental issues. You know how many of us, Ninka, forget that bad teeth and bad dental hygiene can seed the gut, can lead to inflammation in the gut, can lead to fungal production. And now the domino effect happens. And people say, oh, your gut is the problem. No, your teeth were the original problem. And now your gut has taken over as the most visible manifestation. Many people who've even had cancer because of elements that came from root canals that were poorly done or not completed. And then these bacteria seeded different parts of the body. I was talking to a young man who has arthritis. He's 35 years old. And he said, I'm taking this medication for arthritis. I said, why? You're 35 years old. Why do you have arthritis? And I asked him, I said, have you had any root canals or teeth cavities? He said, yes. I said, you're checking the wrong area with regard to your arthritis. Clear up your dental phenomenon and see if your arthritis disappears. Most of the time, you'll see at least improvement. There should not be a young person with arthritis. But that's just an illustration as to sort of the global nature, the whole complete person that you deal with in real science. We're starting to see how things overlap.
And then we haven't even touched upon, that's a whole different topic. There was a study coming out from Iowa University recently with a mysterious connection between food intolerances and autism, which to my knowledge has been known in the community for about 20 years. So it just goes to show that science doesn't always reflect reality and is sometimes 20 years behind.
That is a conservative estimate. In our community, we say that medicine is about 50 years behind, and medical schools are 75 to 100 years behind.
That's crazy.
It is. It is. And look at the information age we live in. Information is coming up within nanoseconds of time. And yet, to get into institutions, it's still taking decades. By the time the institution gets it, that information is outdated already.
So we need to educate ourselves. I have two more questions for you, and then I will let you do your amazing job. I must say, because I've met you in person and I know what place you come from, this heart-based, real, loving intention of making a difference and really helping these children. I know how important it is to you, and we're going to get to how to get hold of you and what the plans are for the future. But two very kind of practical questions for moms is, can thyroid issues be healed? And number two, what about multivitamins for kids? And we've always learned that you need all B vitamins to take in vitamins. So to take in one vitamin, you need all vitamins. It's a common myth.
No. It's a very common myth. Listen, we already know. Let's take this for example. In traditional medicine, if you need all B vitamins, then why is it that if you take only vitamin B12 and you take it for 6 months and recheck your B12 levels, they're usually higher than when you started? You don't need all B vitamins in order for for an individual B vitamin to work. Once again, they're all individual elements. They do their job. Okay. It goes back to nomenclature and how they were named that really brought all this about. They were not named very accurately from a scientific perspective. So don't go with that accent. You don't need. What you need is what you need based upon your biochemistry and your goal. Okay. That's what dictates whether or not you need this B vitamin or that B vitamin. To diet, yes. the idea of food intolerances actually can cause autism in about 3 to 5% of cases. So it is not the majority of cases where certain food challenges occur that can produce this. It's the extreme minority. But now, when we're talking about what is beneficial food, Ninka, you said it already. We've done such tremendous harm in modern society with our pesticides, so that by the time we get food, it's already nutrient deficient, but it's fungal rich by the time we get that food. Then the fungus enters us, and it creates problems all on its own. We don't even recognize it. The very nutritional pieces that we need is not coming from our current diet. Our bodies don't even recognize most of what it is that we get from the grocery store, from the food store, as being food.
No.
We break down these layers of artificial elements that inflame our system. And then some of these strange oils we now use to build our cells, and our cells don't work properly. Yeah. So as you said before, a very clean diet can do wonders in many people. And it certainly is to your best bet to try to get your child to eat as cleanly as possible if they have autism. Even if they don't have autism, it's still the best way to go. Okay, minimize basically the foods that are processed. That's one of the best things that anyone could possibly do.
I actually think that the whole thyroid thing and healing thyroid is a bit too broad, because this whole autoimmune aspect of it, and do you need natural thyroid, is almost like alive in itself. I think
if I can just say, thyroid, you're right. Thyroid is very complicated, has thousands of variables, and no one commentary can address all of thyroid in general.
No. But the last question here is from Jillian. It just came in, and I'm not sure it's because, Jillian, I don't know if you've heard the whole thing, but I think you should go back to the beginning, because she's asking, can you please say something about depression and nutrition? So if we sum up now here to round this off, top this amazing live cast off, I don't know, that was probably not correct English, but anyway.
Well, your English is far better than my Danish.
So what we have been talking about is how depression, anxiety, autism, ADHD, eating disorders, OCD, and did I say depression? I think I did. Mood swings and aggression has a nutritional aspect and has underlying biomedical root causes that you can address by proper testing, proper nutrition, and nutritional supplements. And that you must latch on to Mensah's network, and don't go out there and try and do the testing and choose random practitioners or random educations, because this is almost like forensic work. So
if I may say something about diet, I want to speak to diet actually for a moment, if that's okay.
Yes.
This very interesting point. Remember I said earlier in the conversation, food is a drug. Anyone who has no problems whatsoever, if they take in too many heavy fats, can find themselves more depressed for the day. Anyone who drinks coffee, how many people globally drink coffee? Coffee is a stimulant. It increases your capacities, but then what goes up must come down. And so many of the typical foods that we're just typical drinks that we're casual about are actually drugs that can affect your cognition and therefore your behavior, your reactivity. So if you're having depression, you really do want to eat cleanly, and you want to try to minimize those foods that will either give you too much sugar or too much caffeine or too many of or too heavy in fats, for example. Okay, a very good, clean, balanced diet, once again, balanced diet, will help you along that pathway. If you're speaking purely about nutrition, which comes from food, not nutrient therapy, which is now a prescription and a supplement.
Mm-hmm. And can you just to sum it up, just some basic things that's a characterization of an undermethylated person and an overmethylated person?
Okay, that's a good one. Yes. So undermethylated people are very interesting. Now, first of all, I want to share with you, Both varieties are needed in this world.
Yes.
They give us balance in society. The undermethylators are the very regimented, they're very perfectionistic, very controlling. They're the ones who like to follow all the guidelines. They dot the I's and they cross the T's. They're very fine-tuned, finely motored, finely coordinated. They're the people who prepare life and organize life for us. They are the doctors, the lawyers, the engineers, the teachers, the educational individuals, the computer people, the IT people. They love their exactness. They love concrete thinking. They're very, very logical, and some of them don't do very well if you tell them they have no rules to abide by. Just do whatever they want to do. Okay. Overmethylators, on the other hand, we spend billions of dollars a year on overmethylators. How is that? Most of them are in theater. They're in the movies that we watch, television, acting. They're the poets, the artists, the musicians, the philosophers. These individuals are typically overmethylated, the highly creative people. And so, remember what we said, with high methylation, your brain is a lot more stimulated and active than otherwise. So creativity becomes one of the hallmarks of being an overmethylated person. Okay? But what would life be without music? How many of us are walking around with earplugs and all we do is listen to music while we walk down the street? Well, some overmethylator is responsible for your music, more than likely. And that when we go to the film to lose ourselves, when we engage in theater, Shakespeare, when we talk about mythology, all these things come from the creative concepts that are likely overmethylation. But to educate our people, as Ninka has been talking about, you'll likely go to a person who is undermethylated. The teachers, our PhDs, our educators, our doctors, lawyers, engineers, the people who build our cities, these are the people that we understand to be undermethylated. They're perfectionistic. But let me share with you some challenges. Undermethylators also have highly addictive personalities. These are the individuals where they may try a drug just one time and they're addicted for life. That's alcohol, that's cigarettes, that's marijuana, that's anything. They're also the people who can just start gambling once and they're stuck. Sex addictions. People with anorexia are usually individuals who have undermethylation. Why? Let's look at it. They're perfectionistic, but they're perfectionistic about their bodies. And so their bodies never look good enough. No matter how skinny, no matter how toned, they're looking to improve, looking to do better. These things are so connected. And when you start to break down the pieces, you can understand why the chemistry is oftentimes the foundation for life.
And that's the individuals that would be those hardcore vegans, stick thin hardcore vegans that continue from an idealistic point of view, even though they don't feel good and they would never connect it to their food anyway.
Correct.
And the overmethylators, what's the dark side of the overmethylation?
Oh, wow. Quite often, now overmethylation is not the only chemistry that produces this, but many overmethylators tend to be bipolar. Many overmethylators tend to be the extreme people. Now, they may do drugs not because they are addicted. They do drugs typically because they're trying to tone down all that activity. Remember I said the brains of overmethylated people are constantly stimulated. To live a life where your brain hardly ever shuts down or settles down is horrific. It is extremely challenging. It is depressing. It is one of those situations where how do you continue to survive? Many of these individuals are the ones who are at high risk for suicidal behavior when they engage in taking certain pharmaceutical medications like SSRIs. It's this category, especially in teenagers, that we have to be very careful about. Overmethylators have wonderful, wonderful personalities. They're often extremely sympathetic. If they're working in a hospital, listen, the person you want to take care of you in a hospital is an overmethylated nurse. They will hold your hand. They're often self-sacrificing, much to the detriment of their families. That's one of the other difficulties. They can be very, very self-sacrificing.
And what happens if they get depressed and they are put on a antidepressant or whatever medication for a mental condition?
We often look to screen the type of medication they're being put on. These are the individuals who will actually get worse on your typical SSRI. Why is that? Because overmethylators tend to be high in serotonin, dopamine, and norepinephrine activity. So if you give an SSRI that is something that actually elevates serotonin, well, their problem isn't low serotonin, their problem is high serotonin. So it makes them worse. And the same for norepinephrine. If you give an SNRI, serotonin and norepinephrine reuptake inhibitor, now you've got two neurotransmitters that in the wrong category of person can push them over the edge, and unfortunately some of them commit suicide. We've seen some great actors in the last few years commit suicide, and they were most likely overmethylated people.
And what's the characteristics of the Pyrrol type?
Well, the individual who's pyrroluric, it has severe mood swings. These are the kind of people where they say, in the home, we all tiptoe around them like we're walking on eggshells because we don't know what's going to trigger that person. They can be happy one moment, sad the next moment, rageful the next moment. It's like a 16-year-old daughter getting ready for the prom. I'm so sorry, this is American kind of a thing. But, you know, so much emotionality, so much change in a very rapidly cycling fashion. Now, what's also interesting, people who are sensitive to light or odors or sounds or textures. They don't like the tags on their shirts. The children don't like the seams of the socks. Some of you have seen this. Your 2-year-old comes home, immediately takes off all their clothes and running around the house virtually naked. Likely Pyrrol disorder.
Yeah.
So sensitivities to stimuli, light, sound, odor, texture, are some of the characteristics you'll see in a person who's got a Pyrrol disorder. But pyrrolurics are extremely mood swingy, back and forth.
And sensitive to stress. And last but not least, the copper toxicity personality. What's the warning signs that you might be in that category?
You know, we've talked a lot during this time about the females who've got copper toxicity. I want to spend the remaining time talking about the males. Males you often see very early with behavior disorder, impulsivity, aggression, and yet they're remorseful. Now, many parents don't know what to do with these children. They think their children are disrespecting them, and so they punish them. Then the child says, I'm very, very sorry, and the parent feels better. But then the child does it again the next day.
Yeah.
It's the impulsivity, because copper is a neural agitant. It stimulates and irritates nerve cells. The kids don't have a buffer. They think something and they do it. They don't think, then consider the ramifications. They just jump into it. So many of the children, males who are copper toxic, are often known to the police system by the time they're 15 or 16 years of age.
Wow.
They're often the problematic behavior children that people complain about at age 3, at age 4, at age 5, at age 6, and they seem uncontrollable. And does this sound familiar? No form of punishment seems to do any good. Doctor, I've tried grounding them, I've tried spanking them, I've tried taking away the iPad. I took away the iPad and I got threatened. Okay. And so we back off. We don't know what to do with this person. One of the considerations is copper toxicity. So when you have a male with many of these characteristics, consider copper toxicity. Now, typically speaking, you'll see this pattern with a female in the family who had quite a few of those traits that we talked about already. They may have had postpartum depression or postpartum psychosis, horrible cycles, breast cancer, fibromyalgia, chronic fatigue, anywhere in the female line of that family. If you see a boy, a young male like that, consider copper toxicity and test for it.
You are just amazing. And I thank God that you exist. I do that every day these days, Dr. Albert Mensah. And I am so grateful that I know you're working on medical training and algorithms so that you can go out and teach people to use your algorithms, because if we all had to sit with you, it would be, 10 years for each of us to just understand our own family and do something about it. So that's coming up and it's well underway. But until then, where do people find you and the practitioners that work with you in Australia and in the US and in Europe?
The practitioners in Australia, for example, I would advise you to contact biobalance.com, Australia. BIO-BALANCE, BioBalance, the organization. We've got wonderful practitioners there. And you know the thing about these practitioners, these individuals are usually humble spirits that are so altruistic and caring. They will treat you so well on average. I've been really so impressed with the caliber of people in the medical profession as I have this group for the last 10 to 12 years that we've been working with them.
Yes.
They are all wonderful, caring individuals. In the United States, we've got seminars that we've been working with. We've got personal mentorships that we've been doing. We're building that network of information and understanding. We still have a whole lot more of concrete education to move through for the tougher cases. But, things like anxiety, depression, certainly they're here. People who can help are in that field, are in that area, are around here. You can contact us at www.mensahmedical.com. That's MENSAH, mensahmedical.com. Our U.S. telephone number is 630-256-8308. That's 630-256-8308. You can certainly email us at nurse@mensahmedical.com, or I'll just say Terry, Terri, she's our technical director at mensahmedical.com. But also our marketing person, our new marketing person, is Mr. DJ Wells, and he's DJ@mensahmedical.com. So there are many ways to reach us, and if you've got a question, we're more than happy to try to answer it. If you're looking for guidance in terms of where to find a practitioner, that's something we can at least maybe give you a start. It's not always quite so easy, but as I said, England, the UK, has got one or two good practitioners that we know of. Sweden, I thought, had one as well. So, in Germany, certainly does. So, we're growing that network, and we're doing our best, and we're going to do better. But for now, there is hope. It may be a little bit difficult to find, but it's there, and don't give up. Don't.
Exactly. Don't ever give up, and unite with other parents. Start educating yourself. It can be extremely encouraging to look into this and become knowledgeable. And when you start implementing this, just step by step, a little change in diet and getting rid of the toxins, removing screen time, and just being logical, follow your instinct, then the rewards will encourage you to go even further. So this is absolutely possible. And yeah, my son has no symptoms whatsoever today, and he and his little brother are now speaking this truth and trying to inspire others to do the same thing. Thank you so much, Dr. Mensah, for showing up, and apologize for those who were waiting on us due to a bit of technical issues. Any questions, just post them below, and I'll see what I can do to bring them on and get them answered.
Thank you for having me, and there's no better proof than the living person who is now well. So I'm very happy, always grateful. Every single child who moves into normalcy is a blessing and a reward for us. So thank you for sharing your story and for all the great work that you do to try to help get the word out.
Thank you.